Good morning, class. Welcome to Group Force Teaching Module. Today we will be teaching about exercise epidemiology. So, what is epidemiology? Epidemiology is the branch of medicine that investigates the causes, incidences, and control of diseases. Epidemiologists are important in discovering patterns and statistics relating to diseases. They work to keep the public informed on possible outbreaks and the best way to control or prevent future outbreaks or spread. Epidemiologists analyze a variety of type of data. This includes birth certificates, death certificates, medical records, disease registries, public health studies, and surveys, to name a few. Data from these documents can reveal a lot about certain diseases and its spread. For example, sickle cell disease was found to affect African American and Mediterranean ethnicity a lot more than other ethnics. So you can take that and see that there is a target group that is affected by it more so than others. And they use the data that they got from, medical records, death certificates, birth certificates, yada yada, to make assumptions like that. Or even like COVID-19, when it started last year, we didn't know much about it besides, it was respiratory, high fever, kind of flu-like symptoms. But now we know, due to it being about a year since it started, that there is a wide variety of symptoms that come along with this. And we know that it affects the elderly a lot more, or the elderly and the immune compromised a lot more than younger people. So data from those kind of documents can lead to this kind of information being given to the population so that they're aware and informed of the risks and whatnot. So there are 5 functions of an epidemiologist. First is public health surveillance. Public surveillance is the collection and interpretation of data to help guide the public in decision-making and action. For example, data shows that wearing a mask helps prevent the spread of COVID, so it was a decision by the medical professionals to recommend that people wear masks to help prevent the spread. Next would be field investigation. This involves searching for additional cases or clues. This could be a simple phone call or actual in-the-field investigation, like bacteria swabbing for an outbreak of E. coli at a local store. Or when I got COVID last year, around September 2020, I received a call from, what do they call them? COVID tracers, asking me who I'd been in contact with in the last 7 days, had I left my home, what symptoms I had, when did I first know that or assumed that I had COVID, my job, and kind of asked a little bit of my medical history. So that is a form of field investigation. So this is a very important function in identifying like modes of transportation, from people to people, was it from work, and it helps make decisions and create like an action plan. So next we have analytic studies. This is the study of the causes and distribution by like time, place, and person. So they try to calculate rates of spread, death rate, survival rate, symptoms, and target populations who are at a higher risk. These studies are important because they help guide medical professionals in making decisions and creating like action plans. So evaluations of the disease and spread help determine the effectiveness and efficiency of a potential action plan. So when COVID hit and they decided to put this mandated mask thing, they looked into the relevance, the effectiveness, and the efficiency of how well a mask would help slow the spread of COVID. So, and obviously they felt that the pros outweighed the cons when it came to masks, and so that's why they mandated it. So it was a prospective program that was turned into an actual, planning program. So, and lastly, we have linkage. So this includes like connections between agencies like the CDC and major hospitals. This close relationship helps keep the public informed and aware of the risks and whatnot. So these agencies will share data and share information as to spread information across a variety of different agencies so that people are aware of the risks and the public is informed. So how is exercise and epidemiology linked? Well, the lack of exercise can cause various diseases like heart problems, diabetes, muscle deterioration, anxiety and depression, and whatnot. So epidemiologists study the effects of exercise on the human body to make assumptions on how the lack of physical activity causes diseases, or how physical activity can help prevent like early death and other health problems. So they look at how the lack of it can cause problems, and how physical health can help solve those problems. So we're going to look at types of activity levels. So there's 4: sedentary, light active, moderately active, and very active. So sedentary means you spend most of your time sitting or not doing anything. It also means you spend less than 30 minutes a day of intentional exercise. So daily living activities do not count as exercise. So daily living activities could be like doing laundry, making your bed, cooking dinner. Those don't count as physical activity. So this really means that you are doing absolutely nothing but being a couch potato. So, and then also like the type of jobs can be like people that are involved in computers, phone operators, and distance workers. So you can probably assume that during this quarantine, because people turned into their work became distant workers sent home, that their sedentary lifestyle probably increased. So you can see a lot of these health problems probably have increased within the last year. Maybe it have been something lightly as like weight gain, but it happens. So the next we have light activity. This includes doing at least 30 minutes of intentional exercise, and a large part of your day would be on your feet. So some examples would be like walking, shopping, an office job where you get up and you go fax something or whatever. So usually this requires the least amount of energy. It's not a lot of, you don't need a lot of energy to do light activity. Next, we have moderately active. So this requires, it's up in oxygen consumption and energy usage. Some examples include like brisk walking, some dancing, shooting a basketball, jobs like being a mailman, nurse, or a waiter where you're on your feet the majority of the day, working at more of a fast-paced job are examples of being moderately active. So you would be doing intentionally at least 45 minutes to an hour a day of intentional exercise. Lastly, we have vigorous activity. So this is intentionally doing at least an hour or more of vigorous activity that could include swimming, running, jogging, jump rope, tennis, and various other activities. So not many people reach this vigorous activity at this level. So you have to be very active to get to that level. So what happens when you do not exercise? So as I was saying before, when COVID hit and there was an increase of probably sedentary lifestyle because people were working at home, they probably saw weight gain. I know a lot of people that also had an increase of depression and anxiety. My sister-in-law works for Geico. She was an insurance adjuster. She got moved home, and suddenly she just was confined into a room. She wasn't out in the field. She had an increase of depression and anxiety. So, and then there was an increase in muscle bone deterioration that can happen with people that don't move a lot, which when I worked as a caregiver, I saw a lot of these older people that were extremely overweight and they just laid in bed because they didn't want to do anything. And when it was time for them to actually get up and do something, they were weak. And the muscle and bone, they just couldn't do it. And then there's also a risk of increased heart disease and other problems like diabetes and whatnot. So this is why exercise is important.
The difference between morbidity and mortality is that morbidity is the condition of suffering from a disease or medical condition, for example, heart disease, type 2 diabetes, or cancer. Mortality is the state of being subject to death. So, for example, all people will eventually die. For some statistics from the Center for Disease Control, low levels of physical activity are associated with an estimate of $117 billion annually in healthcare costs. Only 1 in 4 adults and 1 in 5 high school students meet the recommended physical activity guidelines. And those healthcare costs can be prevented through exercise. Morbidity conditions can be prevented through exercise. Being physically active will reduce the likelihood of more morbidity and lower the risk of having heart disease, type 2 diabetes, or certain forms of cancer. Mortality rates of people who have these diseases can decrease if more people engage in exercise. So some common morbidity diseases that people have is heart disease, type 2 diabetes, and cancer. So heart disease is the leading cause of death in the United States. Not enough physical activity can lead to risk factors for heart disease, including obesity, high blood pressure, and cholesterol. Heart disease can mean many things, from a heart attack to a lifelong heart condition that is genetic. But many heart diseases are caused by obesity, high blood pressure, and high cholesterol, which are risk factors that lead to heart disease. Type 2 diabetes is also a leading cause of death, and though it's not number one. And physical activity helps control blood sugar, weight, blood pressure, and helps raise good cholesterol and lower bad cholesterol, which in turn reduces the risk for type 2 diabetes. Type 2 diabetes can occur when there's poor diet and little exercise, as many have the similar risk factors to heart disease, and people usually suffer from both type 2 diabetes and heart disease. Some cancers can also be at risk for can be higher risk for people who do not participate in physical exercise, such as bladder, breast, colon, uterus, esophagus, kidney, lung, and stomach cancers. Although many cancers have unknown causes, there are a few types of cancers that the risk for having them is lowered when people are physically active. Midlife, an article on midlife fitness and chronic conditions shows that, people who have lower fitness during the middle of their life have a higher chance of having chronic conditions, i.e. morbidity, later in life. The study was a longitudinal study over 26 years, studying the midlife fitness that has affected the development of chronic conditions later in life. The results of the study were that the highest quintile of fitness, quintile 5, was associated with the lower incidence of chronic conditions compared with the lowest quintile, quintile 1, in men and women. Stated in the article that in this cohort of healthy middle-aged adults, fitness was significantly associated with a lower risk of developing chronic disease outcomes during 26 years of follow-up. These findings suggest that the higher midlife fitness may be associated with the compression of morbidity in older age. So overall morbidity statistics and rates can become lower with proficient exercise, as proven in this studies and many other studies that will be mentioned by my group.
Why exercise is essential. Exercise is a recognized behavior that enhances human health since the Greco-Roman empires. Hippocrates and Galen both wrote about the essential nature of physical activity for good health. From our book, Dr. Morris studied the relationship between physical activity and coronary artery disease in London bus drivers, conductors, postmen, and workers. The double-decker bus conductors that averaged 500 to 750 steps a day were 67% less likely to develop coronary artery disease compared to sedentary drivers, and post workers who walked or rode bikes were in better health than those who staffed mail stations. We also read about in the 1970s, Dr. Poffenbarger and Dr. Blair. Dr. Poffenbarger published his 16-year study about San Francisco longshoremen who loaded and unloaded cargo ships. The ones who were most active, burning 1,000 calories a day more than the rest of the group, were found to be 44% less likely to die from coronary artery disease compared to other workers. Dr. Blair studied the Cooper Aerobic Center in Dallas. These were the first attempts to quantify a study of participants' physical fitness levels using physiological data. So he did graded exercise treadmill test, and he came up with 5 fitness levels that were referred to as quintiles. And what was found was that the death rates in people who were low active, the second to worst quintile, had a 50% lower mortality rate compared to sedentary people. There is enough evidence to establish as scientific fact that physical activity and exercise protect and promote good health. If you're sedentary and begin a modest exercise program, you will cut your risk of dying prematurely by 50%. And lifelong aerobic training was actually found that seniors can have the VO2 max of someone 4 decades younger than them. So normally people, their VO2 max will decline in healthy individuals as they age up to 40%, but not those who engage in lifelong aerobic exercise training. Here's a chart. I'll let you look at that on your own. One study in 2002 showed that each one metabolic equivalent, one MET, increase in the exercise test performance conferred to a 12% improvement in survival. VO2 max was found to be a more powerful predictor of mortality among men than other established risk factors for cardiovascular disease. Another study in 2010 reported again that men who transitioned from having low to high cardiovascular fitness, it's that same number again. They improved their mortality by 50%, and then those who had better fitness, and then it lowered, could be decreased to 50%. So that kind of seems to be pretty steady throughout all of the research that we look at, is about 50% increase if someone suddenly becomes active from being sedentary. There was a study with rats about cardio, and they bred them for either high or low intrinsic aerobic capacity, and the rats who were more physically active had a 28% to 42% increased lifespan compared to the low capacity rats. Not only was VO2 max improved, but it also improved the capacity to transport oxygen, cardiac output, oxygen diffusion to working muscles, capillary density, membrane permeability, muscle myoglobin content, and ATP generation. Diabetes is on the rise, It's primarily caused by genetic factors, but exercise is the most powerful lifestyle factor. So there were 3 studies I looked at regarding diabetes and exercise. One was in China, which compared 2 groups. So they were all pre-diabetic. So one group did exercise only and the other did diet change only. And the exercise only group had a 46% reduction in onset type 2 diabetes. The diet change only had a 31% reduction. A Finnish diabetes prevention study did both exercise and diet change, and there was a 58% reduction, which was also found in a US group. When they combined exercise and diet change, there was a 58% reduction. And they also looked into a drug called metformin, which did decrease diabetes by 31%, but which was not as good as diet and exercise change. Exercise benefits people with HIV. Their life expectancy has risen thanks to antiretroviral therapy, also known as ART, but they also experience other changes that are negatively impact them. Increase in blood lipids, central fat accumulation, lipodystrophy, decreased aerobic capacity. Also, they suffer more from depression and anxiety. And they did a bunch of different aerobic and resistance exercises in a combination, and they benefited from all of them. There was one study, exercise in a bottle. Their main goal is to create a pill that you can take instead of needing to exercise. You could take a pill which would have all of the benefits. However, there's so many benefits from exercise on so many systems of the body that it would be impossible to be able to make it in a bottle. But why did they want to do this? Why not just exercise? This pill in a bottle would be used for people who are severely obese, people who have injuries, who are unable to do exercise at this time but want the health benefits. Okay, I also read an article in Scientific American in 2020 that came out 2 months ago, and it talked about how a lot of people are having gastric bypass surgery to lose weight, but they're actually not healthier like they hoped they would be. So when you have gastric bypass surgery, your body can no longer absorb protein and vitamins the way that it used to, and a lot of them were not they weren't doing any exercise, or they weren't doing other changes, and so their health was actually worse when they lost all this weight, and they were slim now, but they were actually in worse health than when they were obese. So doctors are really stressing to these people that they need to start doing exercise to improve their health. It's not just about weight loss, it's about doing activity. So also mental health benefits of exercise in children and adults included having a positive mood. It had a positive effect on mood, stress, anxiety, and depression. It also helped reduce PTSD in disaster victims. It helped them. This article, which all of these are in the works cited page for you to look at, showed children who had experienced natural disaster. So how does it work? How does your mental health improve from exercise? Well, there's physiological and biomechanical mechanisms. Your endorphins, mitochondria, mammalian target of rapamycin, neurotransmitters, and hypothalamic pituitary adrenal axis through thermodynamic hypothesis. And lastly, there was an improvement of cognitive functioning in Alzheimer's patients. They had improved memory and cognitive functioning when they added physical activity, and their overall mood and quality of life improved.
As you've already learned, having a sedentary lifestyle has a high risk for developing chronic non-communicable diseases. In 1995, the CDC and American of College Sports Medicine, or the ACSM for short, recommended that everyone exercise at least 30 minutes of moderate intensity every day of the week. As the years have gone on, the American Heart Association, or AHA for short, worked with the ACSM to update the physical activity recommendations. You can see these recommendations on the table. The intensity of the exercise is expressed as a metabolic equivalent of task, or MET for short. A MET is the ratio of the person's exercise metabolic rate to the resting metabolic rate. So for example, 1 MET is the energy cost of someone sitting quietly or just sitting down. And as more METs you have, the more energy costing you are doing. The exercise and physical activity pyramid is a balanced plan of physical activity to help improve physical fitness. It breaks down the type of exercise category along with how often you should be participating per week. At the bottom of the pyramid is everyday activities that should be done often, and this helps establish a base for your active lifestyle that can help you move up the pyramid and do more physical activities on there. The next category involves aerobic exercise and recreational activities. These should be performed at least 3 to 5 times a week. Aerobic activities like running, swimming, bicycling should be performed at least 30 minutes for moderate intensity and 20 minutes for vigorous intensity. Recreational activities is recommended to add variety to your exercise plan, and these activities can be like soccer, basketball, tennis, and dancing. Next up on the pyramid is leisure activities, flexibility, and strength training. These should be performed at least 2 to 3 times a week, and flexibility should at the most be 10 minutes long and can be around 3 to 4 repetitions. And then strength training should have 8 to 12 repetitions with 8 to 10 exercises. And then they also recommend that you exercise with strength training 1 every other day so you don't tire out your muscles. And then lastly, on the top of the list, there are activities that should be reduced, like watching TV and sitting for more than 30 minutes. Since we're all stuck at home and having to do school online, you're all probably stuck to a chair all day, like I am. This is bad for many reasons, like shoulder, neck, and back pain. Musculoskeletal disorders are found to be the largest work-related illness across multiple countries. It can affect the muscles, ligaments, joints, peripheral nerve fibers, and supporting blood vessels. There are many ways to help stop the development of musculoskeletal disorders. And one thing you can do is to stand up more often and to move around. It is recommended to stand up and walk around every 30 minutes that you're sitting down. And if you can't keep track of that, you can either set reminders on your phone like alarms, or if you happen to have an Apple Watch, they already have this feature integrated into their Apple Watch and you can just have it on all day. And then another thing you can do is to perform some simple stretches throughout the day. And here are some simple stretches that you can do that are really good at alleviating back and neck pain. And performing any type of stretch or flexibility routine daily is good to loosen up your muscles, because especially when you sit in a chair all day long, these muscles can get tight and very strained. And when you're doing these stretches, you want to do them relatively slowly. If you do them too fast, you might jerk a muscle and you could hurt it more. And while you're doing these stretches, you want to hold it for at least 10 to 15 seconds or as long as you can. And after you perform these stretches, it can help alleviate the stress your muscles feel from sitting down for a long time. And some of these stretches require more room to work with, so just have a good ample area to move around. And if you want more examples or to find just more stretches that you can do to help alleviate pain, you can easily look these up online. You can find a whole variety of stretches you can do. It is also recommended, a lot of these stretches are from yoga or yoga based. So it is really good to at least try and integrate some yoga practices into everyday lifestyle, or at least 2 to 3 times a week, just to increase your flexibility in your muscles. And exercise is really hard to maintain. Everyone can have days where they are too busy to do anything but work or go to school. And then that busy day will carry into the next day and the next day. Then soon you're making excuses for yourself about starting up again, or you're saying you're too tired, or maybe you always try to start to work out, but you find it really hard to maintain that habit and you always drop it midway through or the very beginning. Most people understand this struggle and they have really no idea or a way to fix this cycle. So adding exercise motivation tips to enhance adherence will help this problem. Creating a contract with yourself is a great way to keep yourself reliable um, when you stop working out. Next thing you can do is to reward yourself, to create like a good reward system because it creates positive reinforcement for when you accomplish something good. Though you have to make sure that these rewards are at meaningful successes, because if not, then the prize is doesn't mean anything in the end. It's not as impactful. Another idea you can do is to work out with friends or family. You can keep each other motivated and accountable while you're working out. And if one person doesn't feel like working out, you can always kind of like, come on, like you can do it. We can work out together. Like don't lose out on me. And then another idea you can do is to perform exercises that are fun and enjoyable for you. Because if you perform workouts that are not fun, then obviously you're not gonna enjoy it as much, and then you're gonna slowly get away from it and not do it anymore. So if you start doing workouts that are really fun, enjoyable for you, or you like doing them, then the more you're looking forward to it and the more that you enjoy it and you like to work on it.
So for the next few slides, we'll talk about how the epidemiology of asthma and the epidemiology of anabolic androgenic steroids come to play within epidemiology itself. So starting off with asthma, it's a chronic inflammatory lung disease that affects an estimated amount of 23 million Americans, and however 12 million can experience an asthma attack every year. And so several factors that can influence that development within the severity of asthma are such as environmental exposures, genetic predisposition, stress, obesity, diet, infection, socioeconomic status, and atopy. Within the next slide, epidemiological evidence of asthma in athletes, such as exercise-induced asthma, atopy, and the type of sport have been identified as a major risk factor for asthma in athletes. And so there's also a high proportion of asthma-related deaths as well that has been reported within that specific sporting event with athletes. And so to treat these athletes with asthma, we are mostly given an inhaler to control both the symptoms and inflammation that's been caused, to minimize the effects with the inhaler or the medication, to allow full participation in physical activity and sporting activities for that athlete. But within athletes, asthma diagnosis is crucial just because of how prevalent that condition, with potential implications not only to their general health but also on their competing performance. And so with an overview, substantially asthma is worldwide and can lead to numerous studies of how it can be caused by through certain characteristics of that specific condition. And so observing through that, it just comes to how the epidemiological studies in a variety of population and countries have allowed examinations to be like part of the risk factors. So, such as the previous slide as before, talking about the environmental exposures. And on to the next slide, we'll continue off of talking about the epidemiology of anabolic androgens, which are commonly referred to anabolic androgenic steroids, that are a family of hormones that compromise testosterone together with hundreds of synthetic and derivatives of testosterone that have been developed over the last 75 years. And so the use of anabolic androgenic steroids, it was to improve performance and acquire more muscular bodies that have been on the rise worldwide. And so we'll see that within this tiny timeline that the 1930s and 40s were the birth of the steroid, and how in the 1950s to the 1970s it propagated through elite athletics, to where the 1980s and 1990s that the steroids were spilled into the general population, and how with the 21st century of today it becomes a major world substance abuse problem. And so the global lifetime prevalence is usually within 3.3% within the US, and how it is mostly how men use it more significantly more than women, just to end up being used within high school students as well, to be used for non-medical purposes as well. And how we can talk about how morbidity and mortality can be of use within all of this, because of how it can cause various pathological alterations that are related to dose, frequency, and the patterns of use. And so with testosterone, it going back to the 1930s, it was isolated through numerous synthetic androgens that were quickly developed thereafter. And so with athletes soon discovering that the dramatic anabolic effects of these hormones, it spread rapidly through elite athletes in bodybuilding from the 1950s through the 1970s. And it also increased the history through it, because of how widespread it was emerged from the athletic world into the general population. And so it was the great majority of steroid users that, as before I said, they're not only competitive athletes, but usually typically around high school to young to middle-aged men, to use steroids primarily for personal appearance. But however, it can also lead to an increase in suicide and violent death within certain individuals with a history of long-term use of steroids as well, through the morbidity and mortality from the epidemiology.
Hi everyone, my name is Ravi and I will be presenting the different effects exercise has on the various systems of the body. The three that I will be focusing on are musculoskeletal system, cardiovascular system, and the nervous system. Having a healthy and adequate musculoskeletal system is a key factor for maintaining functional capacity, independence, and a good quality of life. This is seen mainly within the elderly. Over time, they start to lose functional capacity. They will need walkers to get around, wheelchairs, or even extra assistance in completing daily activities. Having impaired functional capacity and a degenerative disease of the musculoskeletal organs is one of the most prevalent and increasing sources of morbidity and suffering. However, individuals who actively participate in physical activity throughout their lifetime will postpone or even prevent musculoskeletal disorders. Um, some of these will include lower back pain, neck and shoulder pain, osteoporosis, or even relative fractures. In addition to that, it's also beneficial for individuals who are recovering from surgery. It will help strengthen certain muscles that will get them back to their functional capacity. And then also, a substantial part of age-related decline in functional capacity is not only due to age, but also the fact that as an individual will get older, they will not participate in physical activity as much as they used to. So some short-term effects that can come about when exercising include an increase in blood flow to the tissues. Muscle fatigue is when there's an inability to continue a certain muscle contraction with the same amount of force. Muscle exhaustion when you exercise through muscle fatigue without rest. Muscle damage is when you overstretch without proper warm up, or if you go straight into an intensive workout without having any proper warm up. Cramps when you have uncontrollable and painful contractions. There's also some long-term effects that come about, which is muscle size. Muscle size is when the muscle gains the ability to adapt to stress over a period of time, which causes it to increase in size. Muscle coordination happens when, say, you practice dribbling over a long period of time, your muscle will ultimately, gain that skill and technique. And then continuous blood supply to the muscle will make sure that it gets proper nutrients, minerals, vitamins, which will help it become more effective, faster, and ultimately even repair itself faster. In longitudinal studies and investigations, people with high levels of muscular strength have experienced fewer functional limitations and lower incidences of chronic disease. Studies have shown that sedentary lifestyles lead to the development and progression of cardiovascular disease. So, individuals who actively participate in physical activity will, over a long period of time, will prevent onsets and development of cardiovascular disease. It has been shown that long-term exercise reduces blood pressure. So, it will exercise will increase stroke volume and heart rate. In simpler terms, exercise will make your heart stronger. It will allow it to pump more blood with less effort. And over time, the force on your arteries will ultimately decrease. In addition to making the heart muscle stronger, frequent exercise can also increase insulin sensitivity. And it does this by moving glucose into the muscle for storage and promotes immediate increase in insulin sensitivity. So, so exercise is known to help with cardiovascular functions, muscular skeletal functions. But in addition to that, exercise can also be beneficial for the nervous system. For example, exercise can delay onset of Alzheimer's, depression, and Parkinson's disease by lowering chronic stress. According to some health experts, chronic stress is considered to contribute to the diseases that I have just mentioned. In addition to that, physical activity can slow the progression of these certain diseases, such as Parkinson's, by improving an individual's mobility. It decreases the risk fall and other complications that are associated with these certain diseases. Um, Vigorous exercise can ward off changes in the brain that that are caused by these neurological diseases.